Hi everyone, welcome to my YouTube channel, The Anxiety Mentor. This is my first post, my first video that I've ever recorded for any kind of social media. My name is Evelyn Behar and I am a clinical psychologist. So let me tell you a little bit about myself. I did my undergraduate training at the University of Virginia in Charlottesville. From there, I went to Penn State University in State College, Pennsylvania, where I did my master's and my PhD. From there, I did my clinical internship year at the Boston VA Hospital's National Center for PTSD, Post-Traumatic Stress Disorder. And then from there, I completed a postdoc at the Center for Anxiety and Related Disorders at Boston University. So I have a lot of experience researching and treating anxiety disorders in particular, but also depression, sleep disorders like insomnia, and sexual dysfunction. But really my whole career has just been looking at anxiety disorders in general and fear in adult populations. So I know some about treating anxiety in children, but my real specialty is in adults. I also teach people how to do cognitive behavior therapy. So that's really kind of one of my teaching specialties is to train up-and-coming clinicians in how to be really good cognitive behavior therapists. Cognitive behavior therapy is a type of therapy that I'll talk a lot about on this channel, and I hope that you are able to learn from whatever information I impart to you. I wanted to just tell you, I think, a little bit about what made me fall in love with clinical psychology and anxiety disorders in particular. At some point, maybe I'll do a video telling you about the moment that I knew I wanted to study and treat anxiety disorders for a living. But the long and short of it, more broadly, is that I think I kind of fell in love with the fact that even though clinical psychology is very much an art, there's a real art to doing it and to helping people in the therapy room, there's also a science to it. And that's the part that a lot of people don't know about. Just lay people in the community don't really realize that there is a tremendous amount of research in clinical psychology, and in particular, a tremendous amount of research on anxiety disorders and depression. The best treatments that we have in clinical psychology are for anxiety disorders. They're really very powerful treatments. They have helped just a tremendous number of people. They can be extraordinarily powerful treatments if they are done correctly. And the kicker is that you can treat anxiety and fear disorders without medication. So even though some people might have to be on medication, or maybe that is the best choice for them, by and large, people do not need to be on medication to treat their anxiety and fear-based disorders. And we'll talk a little bit about why that is and why actually sometimes medication can interfere with making your anxiety and fear better in the long run. I see a lot of content on YouTube and Instagram and all of these social media outlets, and there are some really well-intentioned people who are trying to impart information to suffering people in the world on how to help themselves through anxiety, through depression, through whatever. And while some of the information is good and accurate, I very often find myself listening to these channels and saying, wait, that's not true. And that thing that this person just said is not accurate. And actually, what they just suggested will likely make people's anxiety feel a little bit better in the short run, but make it a lot worse in the long run. And it kills me to see this and to not have a platform to kind of like raise a banner and say, wait, that's actually not true. And so I'm kind of stepping outside of my own comfort zone a little bit. This is not, my comfort zone is definitely in front of a lecture hall at a university with lots of students sitting in the chairs. But I'm a little bit out of my comfort zone doing the social media thing, but I'm gonna push through it. We're gonna talk about pushing through anxiety a lot. I'm gonna push through it and I'm gonna see how this goes. Hopefully I will have some valuable information for you. And if that's the case, then please mention it in comments and videos. and let me know what you like, what you don't like, what you agree with, what you don't agree with, and I'll try to continue creating content that is valuable. The ideal scenario, of course, is to go to a therapist, somebody who is really well trained in cognitive behavior therapy for anxiety disorders. There are a couple of obstacles to that, because that really is the ideal. The first obstacle is I have found that most therapists in the community who bill themselves as being cognitive behavior therapists very often are not doing CBT the right way, cognitive behavior therapy the right way. And in fact, they are often making some classic errors that could actually make people's anxiety and fear worse. And so even when you have the resources to go out and go to a really, a therapist who is in private practice, it's very, very hard to find somebody who really, really knows what they're doing when it comes to treating fear. The second big obstacle, of course, is money. A lot of people I know in private practice are charging $350 to $550 an hour. These are PhD level psychologists. Some of them are really, really good, but it's a lot of money. And I don't know about you, but I wouldn't be able to afford paying $400 an hour once a week. That would really be out of my budget. And I think that it's out of most people's budget. And if you can afford it, then that's fantastic, and you should absolutely go to see somebody who really knows what they're doing in treating anxiety. If you can't afford it, then you have some limited options. And my goal here is really to try to help you help yourself as much as possible, with the caveat, of course, that I'm not acting as your therapist, so you have to take whatever I say and really evaluate for yourself whether what I'm recommending makes sense for you. And, I'm going to impart as accurate information as I can, but we also have to remember that I'm not having a one-on-one conversation with you. And so, I don't have the luxury of hearing some of the nuances of your personal situation to be able to cater a recommendation to specifically your individual situation. So with that caveat in mind, I'm going to do my absolute best to just give you the most evidence-based information that I can. I also recognize that you guys are not going into the scientific literature and reading articles. Number one, most people don't have training in how to read and digest and critically examine a research paper to see whether the methods and the procedures that were employed by the researchers are good. And so I have spent 27 years reading research papers and digesting the research and critically examining it. And my goal really is to take that research and package it for you in a very understandable, easy, intuitive message that you can then take and apply to your own life. And I'll tell you about studies that have been done. I'll name the studies. I'll talk about what the researchers did, what they found, and most importantly, the recommendations, the clinical recommendations that come out of those findings and how we can apply those recommendations to highly specific anxiety cases. I'm really looking forward to getting the channel started. If you have any specific recommendations or suggestions for topics that you really want to hear about, please leave them in the comments, and I will check the comments regularly and really try to create some content that is evidence-based and accurate, and always with an eye toward recommendations for how you can help yourself manage and move beyond your anxiety to be the most resilient person you can possibly be. Okay, really looking forward to it, guys. Bye-bye.